And here is your question. Right, so if you've read and understood, considering that history taking station, kindly begin.
Yes, ma'am. Hello,
Hello,
good evening. I'm Dr. Jahan, one of the surgical doctors here. Can I confirm your name and age, please?
I'm Lisa. I'm 54 years old.
Nice to meet you. How can I address you, Miss or Mrs.?
Yeah, you can call me Mrs.
Okay, so nice to meet you, Mrs. Lisa. Today I'm here to talk about your problem today. Could you please tell me more? Why are you here today?
Yes, doctor, I'm having this pain in my back for last 5 years, but it's increasing in severity.
Mm-hmm. I'm really sorry to hear
Please
that,
help,
Mrs. Lisa.
please help me out.
Yes, yes, of course I will. Could you please tell me about the site of the pain? Actually, which side you are having this pain right now?
Yes, it's on the lower back.
Okay, so Miss Lisa, do you need some painkiller?
No, I'm fine, thank you.
Okay, so how does the pain feels like?
Yeah, it's cramping.
Okay, does it goes anywhere?
No,
Okay, is it come suddenly or gradually?
yeah, it's mostly all the time, but after, you know, as the day passes, my
Mm-hmm.
pain increases.
Oh, I'm really sorry to hear that, Mrs. Lisa. So, if you had to rate the pain from 1 to 10, where 1 is the minimum and 10 is the worst, how would you rate it?
Actually, it varies. Right now, it's around 7 or 6 like this, but sometimes
Oh,
it goes up like 9,
oh
8,
my God.
maybe.
I'm, I'm
Yeah.
really sorry, Mrs. Lisa. I can see that you are going through a lot. So could you please tell me that is the pain, do you have any strain sensation in your legs?
Pardon?
Do you have any strain sensation in your legs or your buttocks?
No, nothing. I am not aware of that.
Okay, any numbness or any weakness in your legs?
No, doctor.
Any problem with your peeing and pooing?
No, doctor.
Any stiffness in the morning?
Yes, sometimes I feel stiff, but not always.
Okay. And what about any history of injury recently?
No, doctor. There's no history of injury.
Have you noticed that your bones are breaking very easily nowadays?
No, my bone is never breaks.
Okay, that's good. And Mrs. Lisa, so could you please tell me, do you have any medical conditions that you are taking medications regularly?
No, doctor. And
Okay, that's
sometimes
good.
take some painkillers for this pain.
Okay, okay, I understand, Mrs. Lisa. Do you have any history of surgery?
No, doctor.
Any history of allergy?
Yes, I am allergic to penicillin.
Oh, that's very great because you know that. That's
Yeah.
very good. And could you please tell me any history of fever?
No, doctor.
Any
Yeah,
unintentional weight loss?
doctor.
Or what about your appetite? Is it good?
Yes, doctor.
Okay. So I'm going to ask you a few personal questions. Are you okay with that?
Sure.
So what do you do for living?
I am a bank job holder.
Okay, so you're a banker. That's good. And could you please tell me anyone in your family having this kind of problem?
No, doctor.
Okay. And do you smoke?
No, doctor.
Do you drink?
Yes, occasionally.
Okay. Whom do you live with, Mrs. Lisa?
And my husband and my children.
Okay, that's great. And do you have any history of chest pain or any other joint pain?
No, doctor, just the pain on my back.
Okay. So, Mrs. Lisa, could you please tell me that what do you think is happening to you?
I think as I am getting older, my bones are, getting fragile or something like that.
Uh-huh. Okay, I understand. And what concerns you the most?
And the pain is I cannot do my households chores,
Oh,
chores.
I'm I'm really sorry. And what do you expect us to do for you?
Yeah, please help me out with this pain.
Of course, we will do our best, Mrs. Lisa. So, Mrs. Lisa, is there anything you want to add I might have missed to ask you?
Yeah, now as you mentioned that my pain, it gets worse after lifting some weight or doing some household chores, and I have to, take care of my disabled husband. So
Oh,
I have to do all the households on myself, and then
mm-hmm.
after doing all these things, my
Hmm.
pain increases.
Can you please
Oh, I'm
summarize your history
really
taking now? Yes.
okay. Thank you so much, Mrs. Lisa, for your kind cooperation. So, Mrs. Lisa, 54 years old, allergic to penicillin, no family history. She is a banker, social drinker. She has a disabled husband, and she has a lower back pain for last 5 years, which is increased by for last 3 years. It's a crampy in nature. It's a moderate to severe type of pain. It's increased by heavy lifting and take care of his disabled husband. And it is continue in nature and gradually increasing. She has no history of strain sensation in her legs or buttock, no numbness or weakness in her legs, no problem with her bowel or bladder, and
Okay. So
she
what
has
are your,
stiffness, but
yes, provisional and differential diagnosis?
so it may be a mechanical or functional back pain.
And this is
And
provisional. And what could be, yes,
the
differential?
other differential diagnosis will be prolapse intervertebral disc,
Good. And
ankylosing spondylitis,
you're very good.
trauma, and
How do
osteoporosis.
you plan to investigate this patient?
Okay, first of all, I want to do a full clinical examination of this patient.
Good.
Then I want to do the blood examination like full blood count, liver function test, urea electrolyte, CRP, and X-ray of the affected joint. Then I want to do an MRI.
All right. And do you think
And
X-ray with DEXA scan would help? Yes, to rule out if
X-ray
there is,
and
because second one of your differential diagnosis is intervertebral disc prolapse. So how do
that's
you
why I'm
plan?
going for MRI or
Okay.
CT scan.
How do you plan to manage this patient?
Okay, first of all, I want to optimize the patient. Then I want to see it is a simple back pain or any other thing. If it is simple back pain, then I want to advise the patient to stay active, avoid prolonged bed rest, some physiotherapy also, and some analgesia and
Yes.
some muscle relaxants. And I want to refer this patient to social worker as she has a disabled husband.
Very good. Good. Right. Any feedback?
Yeah, as you have asked me at last that is there anything you missed, then I prompt these things. But I think it's better you ask yourself what are the relieving factor and aggravating factor.
Aggravating
Yes, I
factor.
think,
Okay,
yes,
good.
I
This
forgot
is
to
she
ask you
missed.
that.
And
Yes,
what else
yes.
she missed? Character of the
Uh,
pain. She did not ask you to describe the character of the pain.
Yeah, ma'am,
But
I asked
no,
him.
she asked,
He
I
said
told that
crampy.
cramping pain,
Crampy.
yes.
okay,
Yes.
all right. I missed. Because yes, that is the only thing. And the timing, what is the exact timing? Because she asked if patient experiences morning stiffness, but not the timing. If there is any
Yes,
particular
is it
time when you,
continuous? Is it continuous or is it
okay,
intermittent or like this?
Yes, I asked. Yes.
okay, like this. All right, very good. Because radiation, she asked, even she asked to rule out chordoequina. I'm just thinking, when she told me differential diagnosis, why she never mentioned chordoequina? Because she did ask you if you are experiencing any sensory or numbness of buttocks or any of the weaknesses of the
Yes,
legs
ma'am.
or thigh.
I told you that prolapse intervertebral disc. That's why.
Yes, but not the chordoequina.
Or
Because
no,
you
no.
did ask if there is any problem with the pee or poo. Because in
Pee,
this
yes.
one, yes, urinary or fecal incontinence occurs with chordoequina. So
Chordoequina.
this is
Yes.
one of the differential diagnosis. And the questions that you asked were also asked to rule out this. Because if
Yes,
patient
ma'am.
is having these symptoms, then one of your differential diagnosis other than disc prolapse could be chordoequina syndrome or symptoms or flares or whatever.
Okay.
So that is
Okay,
also
ma'am.
one of the differential. Good, nice.
Okay, ma'am.
Thank you.
You're welcome.